Hey everyone! So in this video I'm going to go through the weekly plan for the week of 427 through 430. This is going to be our respiratory system unit. It's going to be really short. So the summative, which I have planned for Thursday, is going to be more like a quiz because there's not a lot of stuff on it. But before we jump in, I want to talk to you guys a little bit about the grading policy that you should have received a note about last week from Mrs. Markert. So as you guys know now, you'll have the option of taking classes for a letter grade or taking them as pass-fail. Now, if you choose pass-fail, that's going to apply to all of your classes, not just this class. And I know right now it seems like the better option because you can kind of slack off, right? Because an A would be the same thing as a D because it's an A and a D are both passing. But this applies especially for juniors. If you are planning on applying to a really prestigious school or a school that's a little bit harder to get into, and on your transcripts, if you have a whole semester of pass fails or just says pass, and the school knows that you had an option to take a letter grade, it's not going to look good on your transcript. So keep that in mind. I think you guys are all capable of getting an A in this class. So I think doing the letter grade option would be the better route. Okay, let me know if you have questions about the grading policy. Okay, so this week, for Monday, just kind of take time, explore the materials for this week. I'm going to have a video for you guys to watch about asthma. Some people who are suffering with asthma, and that's going to be our anchoring phenomena for this unit. Just like last unit with Brandon's story, I just want you to ask some questions on Classroom, and then you're going to have a short introductory web quest. I'll show you what that looks like here in a second. First, let's go through the standards for this unit. So anatomy, two things. You need to be able to label the parts of the respiratory system and the alveoli. That's going to be in the introductory web quest that you're going to do for Monday. And then also describe the features of the lungs and the alveoli that make gas exchange efficient. For physiology, this is going to be an Edpuzzle. Explain the physiology of breathing. So how your blood cells exchange oxygen and carbon dioxide to maintain homeostasis. Explain how changes in partial pressure, blood pH, and blood temperature change how hemoglobin binds to gases in the blood. So we're going to do a little bit of chemistry here with this standard. Explain how the paper bag trick actually works to help maintain homeostasis when you're hyperventilating. So that's going to come from a Edpuzzle. Then we're going to learn a little bit about spirometry, which is how a physician might keep track of your lung capacity. So if somebody might have some sort of lung disorder, use a spirometer to measure their lung capacity. So be able to calculate and explain the vital capacity and total lung capacity of a patient and provide a reasonable diagnosis. So this is pretty easy. It's just subtraction and addition. And then medical application, make a claim based on student collected evidence about how exercise impacts the respiratory rate and pulse, heart rate, someone with different respiratory distress symptoms. So this is going to be a take-home lab. You're going to measure your heart rate and your respiratory rate. So you can do it or you can do it on someone at your house. All right, so Monday, watch this asthma video. The introductory web quest looks like this. Make sure you're reading this background information. Just two parts here really quick. So here's another video of a fetal pig dissection. So watch that video as you're watching. Label these things just A through N here. Excuse me. And I did A and N for you. And then part 2, a short video about the alveoli. A few prompts on that video, and then another short video about gas exchange at the alveoli. So the important thing here is to know the 5 important features of the alveoli and explain why those are important for gas exchange. So I have the 5 things here. All you have to do is just explain what they are, how they're important for breathing and gas exchange. Okay, so that's all for Monday. For Tuesday, I will have a video with the web quest answer, so I'll post that as a private comment like I have been doing once you complete that. So make sure you check your answers. And there'll be 2 things for Tuesday. I'm going to have an Edpuzzle posted in Classroom, and then you're going to do this short physiology activity. So part 1 is the Edpuzzle right here. I just explain what to do, and then part 2, we're going to learn about spirometry. So take some time, read this text, look at this graph, and then here is a chart. Patient comes to see you, here's the results, and then vital capacity, residual volume, and total lung capacity. You're going to have to calculate those, and I explain how to do that right here. And then look at your patient's total lung capacity and look at the average, which is in this column right here. Provide a reasonable diagnosis. So for that, make sure you read about her background information. What does the spirometer measure? And list the 5 factors that can affect lung capacity, which are in the background information. Okay, that's for Tuesday. Wednesday, you're going to do a respiratory distress lab. It's a take-home lab. Read the background information. Here's our driving question. How does exercise impact the respiratory rate and pulse or heart rate with different types of respiratory distress? And how would someone suffering from respiratory distress due to asthma react to exercise? So that's our question. Read the scenario. Here are the steps. So you can either do this on yourself, or if you have a sibling or a parent at home that you want to be your test subject, you can do this on them. Just please, if at any time you or your test subject becomes lightheaded, please stop immediately. We're going to do mild respiratory distress, which you're going to use the paper, or excuse me, the cardboard insert from either toilet paper or paper towels. So I hope you have that at home. And then severe respiratory distress, you're going to use a straw. So if you have a straw at home, I think you guys should, hopefully you all have a straw at home. If you're not, be creative, use something else, has about the same diameter as a straw. Okay, and then this is your table where you're going to type in your information. And then your CER, so make sure your claim answers our question, which is highlighted here. Your evidence needs to come from the evidence you collected. Make sure it's quantitative. And then for your reasoning, look at these terms that I have here, italicized and underlined. You need to use these terms in your reasoning in order to get the 4. And then for help with the reasoning, I posted this YouTube video right here, which goes through, and I think these terms are even in order in this YouTube video. Okay, that's Wednesday. And then Thursday, I'll have the summative posted. It'll be, like I said, really quick, and I'll give you Friday to complete that too if you need to finish that. But I think you should be able to do it in one day. All right, have fun this week. Let me know if you have any questions.